In the womb, the mouth tissue forms as a single block during the 4th week of pregnancy. The tongue frenulum allows the tongue to grow in a forward direction towards the front of the lower jawbone, and the lip frenulum holds the lip against the upper jawbone. Cells die off from these frenula over time before birth to allow for proper mobility of the tongue and the lip. Tethered oral tissue, or TOT, occurs when the cells do not completely die off from the frenulum, attaching excess tissue from the mouth to the tongue or the lip. In some cases, excess tissue can be tied from the cheek to the lower lip or jaw. TOT occurs in about 4 to 10% of all infants born today. Tethered oral tissue and its effect on breastfeeding. When a baby breastfeeds, his or her tongue lifts up and sticks out to meet with their lip that then puckers out to latch onto the mother's nipple. When there's a problem with any of this, the baby will try to nurse with their gums, which involves a lot of chomping that is painful for the mom and not effective for the baby. The impact of tethered oral tissue on infants includes inability to latch, an unsustained latch, sliding off of the nipple, prolonged feeds, unsatisfied babies after even very prolonged feeds, falling asleep at the breast, gumming or chewing on the nipple, poor weight gain for the infant, an inability to hold on to a pacifier if that's something that's being provided to the infant, and possible issues with excessive gas, spit-ups, or colic. The impact of tethered oral tissue on mothers includes flattened, creased, or blanched nipples after feeding, cracked, bruised, or blistered nipples, bleeding nipples, severe pain with latching, incomplete breast drainage, infected nipples, plugged ducts, mastitis, thrush, and the need for supplemental bottle feeding at least some of the time with pumped breast milk or formula. There are a few different types of tethered oral tissue disorders. These are the 2 most common types. Ankyloglossia, or tongue tie, impairs the tongue's ability to stick out or lift up all the way, which has multiple potential issues associated, including feeding problems such as the breastfeeding issues we've mentioned, as well as other issues such as getting food off of a spoon or sticking the tongue out to lick an ice cream cone, speech issues such as issues with lisp or pronunciation, and dental problems such as an inability to remove the food stuck on one's teeth with one's tongue or to brush the teeth completely, an inability to stick out the tongue, and problems as an adult potentially with issues such as a TMJ jaw disorder or with headache. Tethered labial frenulum, or lip tie, does not allow the upper lip to lift up or protrude out all the way, which can cause a number of issues as well, including feeding problems, dental problems causing a large gap between the 2 front teeth or an inability to brush the front teeth leading to dental decay. Evaluation and treatment of tethered oral tissue. There are medical procedures to help correct tethered oral tissue disorders. Although the procedures are only one part of a complete solution, they can be performed on very young children under local anesthetic in our clinic. Older babies with teeth are often better treated in an operative setting with some sedation. It's entirely up to the parent how they would like to treat their child, but it is by no means a selfish or cosmetic decision. When the procedure is performed in office, a sucrose solution, which is a sugar solution designed for infant pain relief, and infant Tylenol are provided. The baby is placed in position and a small amount of numbing medicine is administered into the frenulum. The frenulum is then retracted, clamped, and a small amount of tissue is clipped. No tissue is removed. The diamond of muscle is exposed and bleeding is then controlled with silver nitrate, which has a natural antibiotic in it. We know from older children and adults who have the procedure performed in clinic that the procedure is not painful beyond the first 2 seconds of the numbing medicine being injected. Often the worst part for the baby is being restrained or the taste of the instruments or medications used. When the procedure is performed in the operating room, a calming medicine is provided if needed. The baby is placed in position in the operating room and an anesthetic gas is given along with a small amount of numbing medicine. Again, the frenulum is retracted, it's clamped, and a small amount of tissue is clipped. The diamond of muscle is exposed, the bleeding is controlled, and in this case, we do place some sutures that melt on their own that don't need to be removed. Overall, these clipping procedures are extremely safe and very well tolerated by most babies. There are some risks associated, and these can include bleeding, infection, scarring, recurrence of these ties, and need for further procedures, more specifically a revision procedure, but this is fairly uncommon. After the procedure, there are several steps that must be taken for aftercare. These include controlling any pain with a sucrose solution, for which we'll provide you a little extra to take home, using infant Tylenol, or for babies over 6 months of age, infant Motrin, and Oragel Naturals or other similar agents that you can apply directly on the area that's been clipped. Babies may need pain control anywhere from 0 to 14 days after the procedure. If the baby seems to be in pain, we encourage you to treat it. Encourage oral intake, and you can monitor if the baby is appropriately hydrated by checking how many wet diapers they're having. Offer the breast, but don't stress if it doesn't go well right at first. Doing some exercises after the procedure that we'll teach you is crucial, and they should be performed about 3 or 4 times a day until the area is fully healed. You may need to see lactation back or craniosacral therapy or speech therapy if there are still ongoing issues. There are some exercises after the surgery that will need to be performed. The tongue needs to learn how to move, and care must be taken to prevent the clipped area from reattaching itself. These exercises are crucial to the success of the procedure. It's normal for the clipped area or areas to seem a bit frightening at first. There may be deep holes that appear to be present, and eventually these will heal up nicely and flat, and you'll never know anything was done. Scabs may form in the mouth or may appear white or yellow in color, and they may appear to be pus or dead skin present. Scabs that are lifting off can be scraped off, and if bleeding occurs, it can be addressed by applying pressure with a moist piece of gauze or a paper towel. All of this is normal. 10 or 15% of patients will see immediate results. For a small minority of others, it may take over a month to get the complete results, along with help from lactation consultants or craniosacral therapists. Most patients, however, will see gradual improvements over the first 1 to 3 weeks after the procedure and will be able to accomplish any of their breastfeeding goals. Unlike cancer, where more severe staging means a worse outcome, with tongue or lip ties, professionals know that subtle ties can cause big problems. It's not an issue of how tied the tissue is, but more how much it's restricting movement. Many doctors have not received training in the problem of tethered oral tissue, which can cause delays in diagnosis and undue stress for families. It's important to remember that these procedures are not selfish or cosmetic in nature and can go a long way in helping to alleviate latching, breastfeeding, and other issues.